Hello, I'm Verneri Hietala, a trade advisor based at the British Embassy in Helsinki. I work with UK companies interested in the Finnish healthcare market. I'll give a brief background to the Finnish healthcare system and some of the main trends and opportunities driving the health tech market. But since I'm only now touching the topic, I'm of course happy to continue discussion and provide more information afterwards. You can find my contact details here, so please don't hesitate to get in touch. Let's begin with some basic market information. Social welfare and healthcare is the largest local government function and a central part of the Finnish system of welfare services. Local authorities, currently municipalities, soon well-being services counties, they're responsible for performing the healthcare services laid down for them by law. They may provide the services either alone or secure them from private sector providers. The Finnish health service system is by global standards cost efficient and of high quality. But however, due to the rapid aging of the population, increasing need for care, and the declining workforce, a new health and social services reform is well underway. This will develop public healthcare and social welfare so that the responsibility for the organization of services is transferred from over 300 municipalities to 21 new well-being counties, plus the city of Helsinki. The reform is also used as an opportunity to speed up the digitalization of Finnish public healthcare. There are currently about 160 healthcare centers which are responsible for primary care. And alongside the 22 new counties, the existing 5 university hospitals will continue to provide more critical and specialized care. I also want to highlight the important role of the private sector. Private sector service providers account for just over a quarter of all social welfare and healthcare services. The largest private services include physiotherapy, GP surgeries, dental care, and occupational healthcare. You can see the largest private sector providers listed here. I now want to move on to some of the main trends driving the healthcare market. First, about demographics. The population of Finland is roughly 5.5 million. Since the population is aging faster than in any other European country, the demand for health and long-term care services are also expanding dramatically. By 2030, Finland is projected to have 26% of its population over 65 years of age. Due to the age structure, Finland invests heavily in the health sector. The estimated nationwide hospital investments for specialized medical care and for primary health care in the years between 2016 and 2020 total up to 8 billion euros. The Finnish healthcare financing system is mostly tax-based. As you can see, I have put some older figures in the slide so that the impact of COVID doesn't distort the figures too much. The Finnish healthcare financing comes from many sources. You have the national government, the municipalities, the social insurance institution, and private parties such as households and insurance companies. However, the public sector actors are by far the biggest contributors. Let's now move on to the health tech sector. The health technology market has been growing in Finland in recent years, even before the impact of COVID pandemic. The growth of imports was 4% in 2019 and imports stood at 1.3 billion euros. Exports grew even faster. Growth was 5.7% in 2019 and exports stood at 2.4 billion. The health tech companies operating in Finland have a combined annual revenue in the region of 3 billion euros, and they employ roughly 10,000 professionals. Most companies are export focused. In addition to local companies, some well-known global companies, such as the ones you can see here, have a significant presence in Finland. What are then the main customers for health tech companies in Finland? According to a recent research directed at the manufacturers, importers, and distributors of medical technology devices, public secondary and tertiary care are the most important customers, followed by public primary care. However, if we move to the next slide, you can see that the role of private care as a major client is projected to grow the most by 2025. This development, namely the growing importance of the private sector, is something we encourage health tech companies to tap into as well. So finally, As I said before, I'm happy to discuss with UK companies on how to best approach the Finnish market, so please do not hesitate to get in touch. Thank you.